Okay, good morning. Good morning. Good morning. There you go. That's what I wanted to hear. So please remain standing for the announcement of our assembly, which will be given by our very own Rabbi Nancy Epstein, who's who's an associate professor of community health and prevention at our school.
We give thanks simply and fully for our graduates, for you, their family and friends, our teachers and staff, our dean, for being sustained during the academic year that is coming to a close, and for arriving here today for this moment of celebration. God, whom we know by many names, we ask you to bless these graduates as they prepare to go out into the world. Our world needs every one of them. Keep them safe wherever they go. Bless each one with unbounded compassion for self and for others, and for the courage to persevere when there are no easy answers. Ours is a world crying out, abundant with conflicts and pain, yet also buoyant with joy and laughter, pregnant with possibilities. Teach our graduates to listen to the longings of the world and for how they can best respond to what truly matters, staying open to surprise, awe, and the creative stirrings of solutions waiting to be born. Show each one how to be a peacemaker, for pathways of peace heal our hearts and our communities. O God, we ask that you deliver these graduates with grace into the robust futures that await them. Guide each one to find his or her right role in making our world more just, more loving, and more healthy. Bless them, bless all of us, and bless our world. And let us say, Amen.
Thank you, Nancy. Please be seated. So, welcome. I am Ana Diaz-Rue, and it is my honor and my privilege to be the Dean of the Dornsife School of Public Health. And it is my pleasure to welcome you to Drexel's 129th commencement. But most importantly, it is my pleasure to welcome you to our very first Dornsife School of Public Health graduation ceremony. Woo! And on behalf of my colleagues at the Dornsife School of Public Health, I am honored to be the first to say congratulations to the class of 2016. We thank you, as the faculty of the school and the staff, we thank you for the privilege of getting to work with you, to mentor you, to train you, to learn from you, to discuss with you. And now we wish you the very best in the next steps of your career in public health. And we're very proud of your accomplishments and wish you the very best success as alumni of our school. I am pleased to announce that the faculty of the Dornsife School of Public Health are assembled with the students whom they have taught, mentored, and recommended for academic degrees. And I also want to extend a special welcome to a very special guest that we have today, Thomas Farley, who is Health Commissioner for the City of Philadelphia. You graduate at a very exciting time for public health. There is growing recognition that so many of the things that we do as a society affect population health. and that truly multi-level and intersectoral approaches ranging from social policy and urban planning to targeted treatments for cancer are necessary to improve the health of the public. Medicine and public health, sometimes artificially divided, are converging through the rediscovery of population health by the healthcare world, which is so nice to see that they've realized that public health is the core of health. We have rich and varied new data and new tools to understand and act on population health. And we also have old data and old tools, which are pretty good too. And there's emerging consensus that health is linked to social inequality and that improving population health requires really addressing health disparities by class, race, sexual orientation, and geography and gender. We know that public health problems are increasingly global, not just as a result of the epidemics that span the globe, but also because it is increasingly apparent that the health problems faced by cities and countries all over the world link to things like social inequality, adverse environmental exposures, climate change, sedentary lifestyles, growing reliance on processed foods, to name a few, are common across cities and countries worldwide. There are many challenges ahead, but also unprecedented opportunities as we think about public health in this very broad, evidence-based, and action-oriented sense. So go out and use what you have learned. Most importantly, keep learning and seize these opportunities to improve the health of the public wherever your career takes you. So congratulations. It is now my pleasure to introduce Wen Kuni Siant, who will address us on behalf of the class of 2016. She will be graduating with a Master's of Public Health in Health Management and Policy. She previously attended Howard University, where she graduated Phi Beta Kappa with honors, with a Bachelor's of Science in Biology. And she aspires to one day, and I'm sure already, integrate public health and medicine in her work to eradicate health disparities both domestically and abroad. So welcome.
Thank you, Dean Ruiz, for that marvelous introduction. Thank you all. What an honor to speak to you all today. Thank you for this opportunity. Greetings, esteemed guests, colleagues, alumni, professors, and the graduating class of 2016. We are gathered here today to witness the graduation of a generation of public health professionals that believe in the principle of health as a human right. When we arrived at the School of Public Health, we were not yet privy to the transformative nature this institution would have upon us. Here at Drexel University, I found myself surrounded by change agents, policymakers, physicians, epidemiologists, and engineers. At our School of Public Health, an era of innovation and change was apparent. And in fact, an undercurrent we felt pulsating throughout the classrooms and within the hallways each day. Fortunately, as we were changing internally through our education at the School of Public Health, the school was also changing. I am proud to say I was able to sit in the naming ceremony when Dana and David Dornsife changed not only the name of the School of Public Health, but the institution and individuals in which it contained. I always wondered how much money it would take to get my name on one of these buildings. Now that I know it cost a mere 45 mil, I guess I got a lot of work to do. If you do have $45 million, please see me after. It'll only take a minute. As this energy was channeled throughout Drexel, I wondered what my impact would be. After seeing such a large donation made to our School of Public Health, I felt catalyzed into purpose. I felt left with a charge. How will I change the world of public health? So now I pose this question back to all of us. How will we change the world of public health? Some of my classmates have already begun down this path. Understand, this speech is less about me and more about the remarkable accomplishments of my classmates, friends, colleagues, and indeed professors. They say global is local and local is global, and I know this to be true. I watched my friends go to places like Malawi, Ghana, Rwanda, Uganda, and Zimbabwe through the Dornsife Global Development Scholarship Program. We have already began to change the world. I too was blessed with the opportunity to go to Africa, the motherland, for the very first time, where I got to interact on a daily basis with legends in the global health community. My classmates and I sat at the feet of Dr. Marquez, Dr. Vibert, and Dr. Mock, and learned about the Gambia's history and health system. We went to West Africa, a group of strangers. We returned back to the United States as a family. During my experience, I realized that each person had something to teach me or show me about the world around me. It was in the Gambia that I realized that each person is endowed with a specific set of gifts with which they can change the world. The people who told us stories of saving lives and delivering babies by candlelight in places that simply did not have access to electricity. They taught us it was a privilege to serve their own communities. No amount of money or degrees could parallel the lessons that we learned there. We learned about maternal and child health. We learned about health infrastructure, but most importantly, we learned about ourselves. Sitting in the health clinic in the Gambia, listening to the personal anecdotes that the people told me about the innovative ways that they got by on little to none, made me too realize that I had a story to tell. We've all had that life-changing experience, whether it be learning to help babies breathe in the Gambia, or fighting hunger in Camden, or rebuilding communities right down the street in Mantua. We all have stories to tell. But when I was in Africa, I was in a place that seemed like a distant memory to me. You see, I'm a young woman whose parents weren't born in this country. My grandmother couldn't read or write. I narrowly escaped the jaws of the most impoverished country of the Western Hemisphere. Many of you know this country is Haiti, but I know it is IET, and it's a country that's often categorized by its poor economic circumstances. But I always remember the old adage that I heard growing up. Même si pays moins pauvre, nous gagnons riche histoire. Which simply means that although my country may be considered poor to some, it has some of the richest history and culture that one may ever encounter. So I stand in front of you proudly as a first-generation Haitian American, knowing that one day I too will be able to return to my parents' country to train and to educate and to heal. Many of my peers can identify with the story of the first generation in the family to go to college, or maybe the first person in the family to pursue a graduate degree. Maybe we did school part-time while raising a family. Maybe we came all the way to the United States to study. No matter our story, we find solidarity in our struggle. It takes a whole village to raise a child, as the old African proverb says. I must also take this opportunity to thank the village that raised me, my family who's sitting in the audience today. We must all take time to thank our villages, as they are each the reason we are sitting here today. Yet I must also realize that due to the opportunities I have been afforded, I am privileged. In fact, most of us sitting here in cap and gown are. Privileged to gain a first-rate education from one of the most outstanding schools of public health in the country. But before Drexel, I attended the illustrious Howard University for my undergraduate degree. As a matter of fact, I was at Howard not too long ago to listen to our President Barack Obama, or as I call him, Uncle Barry, speak. I remember President Obama noting that passion is vital, but you have to have a strategy. At Drexel, I was able to further my education of health disparities and learned how to address vulnerable and underserved communities. Drexel gave me that strategy. Howard gave me that passion. At Howard, I learned why Black lives matter. My education at Howard and Drexel has molded me into the young woman that stands before you. Howard may have given me my wings, but Drexel taught me how to fly. My coupled education has taught me not only what inequities are, but how to combat them. DJ Khaled taught me that although they don't want to see you do well, that as a minority in this country, we have to do well, twice as well even. Most importantly, this does not only apply to Black lives, but also to those persecuted each and every day due to their race, religion, gender, or sexual orientation. It is for this reason I implore each and every one of my classmates to understand that our survival is intrinsically connected to the survival of others. This was exemplified to me recently as a good friend recommended a TED Talk to me. But this talk was different. It featured one of Drexel's own, Dr. Tererai Trent. Dr. Trent's talk left me both in tears and inspired as she left me with this message which I feel compelled to share with you all today. We must tie our dreams to the embetterment of our communities. Colleagues, I leave you with the same charge. What will be your major key? What will you do to serve your society? Whatever that may be, I urge you never to be selfish in your aspirations, but instead work towards building a better global community to make our world better for not only ourselves, but for the generations to come. Thank you.
Thank you so much, Mankuni, for those very inspiring words. Now it is my pleasure to introduce the Associate Dean for Academic and Faculty Affairs, Yvonne Michael, and the Director of Student Services and Alumni Relations, Phi Nguyen, who will recognize this year's award winners.
Good morning. Let's see if I can find it. Sorry, I have to find my place in the script. Okay. There. All right, finally I do. All right. So now we will recognize students, faculty, and community partners receiving awards today. In the spirit of honoring exceptional academic achievement, I invite the students with the highest GPAs who are graduating with honors to stand by your seats to be recognized. The students graduating with honors are also listed in the awards program. Please stand up. Congratulations. We also recognize students who will be inducted into the Delta Omega Honor Society. All inductees were selected from among students in the upper 25% of their class based on academic achievement, contributions to public health, and potential for advancing public health ideals. The names of those who were inducted into Delta Omega can be found in the awards program. Will the new inductees please remain in your seats but stand to be recognized? Thank you, and congratulations.
All of the award recipients we will honor today were nominated by students, faculty, or staff and selected by a School of Public Health committee. The first award that we would like to present on behalf of the school is the Community Service Award. This award is for a graduating student who actively participates in service initiatives. This recipient exhibits dedication to community or volunteer service and a genuine commitment to the community. This year's Service Award recipient is being recognized for her role working with World Vision as a Dornsife Global Development Scholar and chair of the Community Activism Committee. Please join me in recognizing this year's Community Service Award recipient, Ruth Boancy. The next award is given to a student who demonstrated extraordinary commitment to the practice of public health. I'd like to congratulate Rosie Mae Henson, recipient of the Public Health Practice Award for Students. Rosie Mae was indispensable in her work managing several projects as a graduate assistant for the Center for Public Health Practice. Please join me in congratulating Rosie Mae Henson. The next award is given to a graduating student who has exhibited excellence in leadership. The Leadership Excellence Award is for a graduating student who models leadership qualities for others. This recipient is passionate, motivated, and excels in both curricular and co-curricular activities. Her accomplishments working with underserved communities and positive attitude towards the practice and application of public health make her deserving of the Excellence in Leadership Award. Please join me in congratulating this year's recipient, Christina Bowles. Congratulations to all the Student Award recipients. Finally, on behalf of Dornsife School of Public Health, I would also like to recognize 8 graduates who have served as leaders for their class and the entire student body. They participated in recruitment events, organized social, educational activities, and have been excellent liaisons between students and the administration. Will the officers for the student government organization stand to be recognized? SGO, your involvement as a campus leader has made a difference at Drexel, and Dornsife School of Public Health is a better place because of you, because of all of you. Congratulations.
Thank you, Fee, and congratulations to all our student awardees. Along with the graduates, we also celebrate our distinguished faculty and community preceptors, and without them, the milestone we mark today could not have been reached. Award winners, please remain in your seats, but stand to be recognized. First, the Public Health Practice Award. The Public Health Practice Award recognizes faculty and preceptors who demonstrate extraordinary commitment to the practice of public health. This year's Faculty Public Health Practice Award goes to Sandra Bloom, Associate Professor in the Department of Health Management and Policy. And this year's Public Health Practice Award for preceptors goes to Stacy Truskin, Assistant Professor at Drexel College of Medicine in the Division of Infectious Disease and HIV Medicine. We also have the Golden Apple Award that recognizes faculty who guide and inspire students and stimulate their intellectual interest and enthusiasm through their teaching. So join me in congratulating Tersa Sweet, Assistant Professor of Epidemiology, who received the Golden Apple for faculty with less than 5 years of teaching experience at Drexel University, and Lonnie Tabb, Assistant Professor of Biostatistics, who received the Golden Apple for faculty with 5 or more years of teaching experience at Drexel University. And And last but not least, the Mentor Recognition Award. This award is given by the public health students in recognition of outstanding contributions to the student body in the areas of mentorship, advising, teaching, or other service to the school. So congratulations to Amy Carroll Scott, Assistant Professor in the Department of Community Health and Prevention. It was this year's recipe. Where is she? Oh, there she is. Please join me now in acknowledging all the outstanding members of Drexel's faculty and staff. Thank you, and congratulations to all of you. So this year, on our very first Dornsife School Public Health graduation, we are in for a very special treat. We are honored to have a true public health leader, Thomas Farley, join us to address the graduates. We could not have asked for a better speaker to join us for our very first school commencement. Thomas Farley is Commissioner of Health for the City of Philadelphia. He is a physician trained in pediatrics and epidemiology who worked in a variety of roles in public health. In 2015, he was the CEO of the Public Goods Project, a nonprofit organization that uses messages in the mass media to combat the nation's greatest health problems. From 2009 to 2014, Dr. Farley was the health commissioner for New York City. And you may have heard about his work during those years. In those years, he advocated for innovative public health policies, including making the city's parks and beaches smoke-free, prohibiting price discounting of cigarettes, raising the legal sales of tobacco to 21, capping the portion size of sugary drinks sold in restaurants at 16 ounces, and restricting the burning of air-polluting fuels to heat buildings. New York City has really been a model for cities all over the world, really, in terms of its public health engagement. And this was under Dr. Farley's leadership. Before joining the New York City Department of Health and Mental Hygiene, Dr. Farley was chair of the Department of Community Health Sciences at the Tulane University School of Public Health and Tropical Medicine. Trained as a pediatrician, he served in the Centers of Disease Control's Epidemic Intelligence Service and worked in the CDC and the Louisiana Office of Public Health from 1989 to 2000. And during that period, he directed programs to control various infectious diseases. And he has conducted research and published articles on a wide range of topics, including Legionnaire's disease, prevention of HIV, sexually transmitted diseases, infant mortality, and obesity. And he is the co-author of Prescription for a Healthy Nation, and with RAND senior scientist Deborah Cohen, an author of Saving Gotham, A Billionaire Mayor, Activist Doctors, and the Fight for 8 Million Lives, which I highly recommend. And I think he's really a wonderful speaker for us because he also bridges the world of academic public health and public health practice in a way that our school, I think, has always aspired and continues to aspire to do in order to really improve the health of our city and populations all over the world. So, Dr. Farley, I invite you to share a commencement address with us.
Thank you. What a gorgeous day for graduation, huh? Yeah, it is, let me say, absolutely great to be here in Philly, and it's great to be with so many people who care about the health of the city. There's a lot of people in the room today, but I want to address my comments specifically to the graduates, who I'm excited to be with. You know, I've been through many different graduation ceremonies over the years because I was a professor before I was in public health practice, and I always enjoy them. They never get old. And that's for two reasons. First, these are really golden moments that happen amid times when we're working hard every day, doing things that, let's face it, sometimes can feel a little bit like drudgery. When we take a break, take a step back, and look towards the future with hope and excitement and inspiration, and get that emotional boost we need to get out there and change the world. So it's really great. Second, this gives us an opportunity to stand here and talk very seriously while wearing funny hats. Now, in this ceremony, in this position, I have really a great opportunity to talk about whatever I want to talk about. So long as I keep it in less than 10 minutes, for the parents who are mainly here waiting to take your picture when you cross the stage to get your diploma. I want to talk about something that I think is extremely important, not just to you as graduates, but really to all of us. Now, after you leave, you are going to be working for a variety of different organizations where most of the people there will not be formally trained in public health. And therefore, it's up to you to carry the public health gospel to those organizations. And I want to take then my 10 minutes to talk about a concept that is central to public health, but that almost no one outside of public health understands, and far too many people within public health don't understand. Now, I hope you got this in your classes, but if you didn't, I am determined to take this last chance to get it to you when you can't escape. So here's the point, and that is the field of public health is about populations, not about individuals. Focusing on populations is what distinguishes and really defines public health, not expertise in infectious diseases, not a focus on attention on healthy lifestyles, or not even a focus on social disadvantage. All those are important, don't get me wrong, but that's not what uniquely distinguishes public health. Focus on population is what we uniquely offer to understand how to address the health of populations in large groups. Now, many people who work in health just don't get that. They take on the health problems of large populations, but with the tools that are meant to address individuals one at a time. For example, I'm old enough to remember the early days of the HIV epidemic when we didn't have any effective treatment. Those were dark days. And there was a cottage industry that grew up of nonprofit organizations and researchers that focused on preventing HIV by holding multi-session group counseling programs, where they get maybe 6 to 8 people who meet for an hour once a week for 6 weeks and talk about risk reduction. That sounds good, and it may have prevented HIV infection in 1 or 2 people, but the brutal fact is this: whether or not it helped those participants, that did nothing to slow the epidemic. At that point, there were hundreds of thousands of people who were already infected. There were millions of people at risk. Most of those people would never want to sit through 6 sessions of counseling. And more important, even if they did, we would never have the billions of dollars to spend to make that happen across this entire nation. A population approach would have thought instead, how can we influence the sex and needle-sharing behaviors of these millions of people? That's not easy, but it is possible, and that is the science of public health. That is what we uniquely bring. So why should we then be thinking about people as populations and not individuals? It actually sounds pretty heartless when you think about it. Well, 2 reasons. Because if we do that, we can just save so many more lives. And that really is the ultimate act of compassion, is to save lives in large numbers. You know, one of my heroes in public health, a man named Jeffrey Rose, wrote an article that I hope you have seen that is really a classic now, and it's called Sick Individuals and Sick Populations. In it, he showed that if an entire population shifts its behaviors just a little bit toward health, we save many more lives than if the few people who have extreme risk shift their behaviors or their risk a lot. So we save many more lives if everybody takes in just a little bit less salt than if we get everyone who has hypertension on medical treatment. We save many more lives if everybody is just a little bit more physically active than if the people who are most sedentary suddenly take up a vigorous exercise program. Population approach is about saving lives wholesale instead of retail. A second reason is that people influence each other. Humans are social animals. The children of smokers are more likely to smoke. People are more likely to drink when they're around heavy drinkers. Teenagers often give in to peer pressure to use drugs. A population is not just a random collection of individuals. It's a collectivity. It's an entity unto itself. And it's possible to change that entire collectivity. It's possible to make those small changes that Jeffrey Rose says could save so many lives. Now, a population approach to do that requires abandoning our individual frame that is otherwise so prevalent in our society. First, influencing the health of populations means thinking big. We need to think as big as the problems we are trying to solve. So here in Philadelphia, for example, we have 250,000 people who smoke. We have 375,000 people who are obese. So if you have a program that helps 100 people or even 1,000 people, this sounds mean to say, but that effect is negligible. It's not going to attack the problem. So don't think small. Think as big as the problems you are trying to solve. Second, influence the health of populations means thinking differently. It's not just about doing something that would affect one person many, many times over. It's qualitatively different. Nonprofit organization, for example, that might reach 100 or 1,000 people can never be scaled up to 250,000 or 1.5 million. You hear people doing that, though, and they justify it by saying this is proof of concept, without really asking the question, why do we want to prove a concept if we can never bring it up to be large enough to affect the entire population that we care about it? That's why medical care, for the most part, is not a population approach. And I'm one person who can say this. That's why doctors often don't make good public health practitioners. That's why intensive education is not a population approach. We can't scale it up for the size of the problems we're trying to reach. A population approach to health starts by thinking, how can we reach everyone at risk given the resources that we have? And it ends in a very different place. So for example, to address smoking, an individual approach might be to counsel smokers to quit or to give them medications to quit. But a population approach might be to put a tax on a pack of cigarettes or to pass a law that says you can't smoke in bars and restaurants. For obesity, an individual approach might be dietary counseling. It might be cooking classes. It might be bariatric surgery. But a population approach might be things like subsidies for healthy food or things to reduce the oversupply of unhealthy food, or even taxes on unhealthy food like sugary drinks. Now, how did that get in my talk? I don't know. Somebody slipped it in by mistake. So, in the first couple of decades of the obesity epidemic, everything you heard about it was talking about individual approaches. Finally, now we're on to population approaches, which gives me optimism that finally we are going to solve this major epidemic of our time. In the future, we're going to be talking about population approaches to mental illness and substance use. Right now, we don't have population approaches to these. We see these as illnesses and the people with them as needing treatment. And that's true, but it's insufficient. We need to think, what are the population level causes of mental illness? To answer that, we should think about, why is it that some populations have greater rates of mental illness than others? It's not just in our genes. It's something about the situations in which they find themselves. Why do mental illness rates change over time in populations? And they do change over time. Same for substance use. Answers to those questions will provide clues as to the population level causes of mental illness and substance use, and that'll provide clues as to how we can have population level solutions. Now, I don't have answers to those questions today, but answering those questions are the future of public health, because I think those will be the dominant health problems of the future, and we need to take them on. When I say we, I really mean you, because I won't be around long enough to solve them, but you will. So my plea to you today is, after you leave this great institution, if you forget everything else, remember this: think populations, because no one else around you will. To do that, think big and think differently. Now get out there and change the world.
So thank you so much, Dr. Farley. That was wonderful, and we have a small token of appreciation.
Okay. Thank you very much.
So I hope you took notes. So So it's now my pleasure to invite Shannon Marquez, Associate Vice Provost in the Office of International. Associate Vice Provost in the, let me read all Shannon's titles. In the office, Associate Vice Provost in the Office of International Programs and Director of the Office for Global Health here at the Dornsife School of Public Health, to the podium to recognize this year's graduating students. As many of you know, our school was founded on the principle of health as a human right, and when all of you first joined us, you went through this wonderful event we call the pinning ceremony, which was established back when the school was created by Jonathan Mann, and you received a school's pin and also read the preamble of the Declaration of Human Rights. And today, as you graduate, you'll be handed a copy of the Declaration of the United Nations Universal Declaration of Human Rights as a symbol of your enduring commitment to health as a human right and to improving health for all. And we will start with our Bachelor of Science graduate. And I said graduate because this is our very, very first Bachelor of Science in Public Health graduate. Ryan Popper.
Ryan Popper. Congratulations to our first bachelor's degree recipient. Let's have a round of applause again. Marshals, please escort the Masters of Science graduates and the Masters of Public Health graduates to the stage to be individually recognized. Yadira Jahan Brown. Christopher A. Steer. Lachelle Anita Manning. Elena D. Cordero. Wenkuni Siant. Kiana Atrice Hardy. Asha Lorleen Dorsey. Diana Tao. Joanne Miriam White. Judith Barbara Genty. Kofo-Urala Damilola Adaniki Williams. Olofunlayo Olubambo Osamaye. Itoro Inoyo. Tammy Nicole Hill. Nina Damares Figueroa. Donnell Emilio Smiley. Zachary Houston Daniels. Camille Marie Lukey. Leila Ziad Abdallah. Ricardo Antonio Mora Jr. Lotachukwu Tracy Igwabuke. Kelly King. Luam Tekla Miriam Gebre Christos. Danya Salayad. Daniel Jisung Shin. Vanessa Bo Yi Moy. Tony Cherie Jocelyn Williams. Margaret Jessie Leaf. Sheng Yi Duan. Catherine McNamara. Viren Doshi. Samuel Karen Klossner. Ruth K. Boensi. Iman Adish. Mashal Malik. Bhavika Patel. Shreya Patel. Kushali Patel. Daisy Manapsal. Amandeep Kaur Man. Nathaniel Christian Keeper. Robert Holomiki Kekohaupio Y. Eve Brandon Helu. Andrew Arneo. Jacob Alexander. Hannah Emerson. Danielle Ray Bartolonzo. Bartolanzo. Frederick Robert Ernsberger. Natisha Kamath. Shivanshu Avasti. Shreya Kuntia. Arjita Ray. Ruth V. Patel. Bonnie Gaurav Shah. Rajiv Mavath. Lindsay Ann Berrigan. Rosie Mae Henson. Catherine Lee Rayner. Brittany J. Cook. Elizabeth Marie Kaufman. Jessie Lowell Goldshear. Brenna Lynn Amaya. Kara Beth Fisher. Lauren L. Marks. Marunande Badresh Purvaksi Rathod. Arshpreet Kaur Malhi. Jared Samuel Gorin. Tiffany M. Depew. Ling Yu Kai. Yi Lan Zhu. Xing Yi Miao. Hao Yang Guo. Cheryl Eudora. Michelle Doherty. Andrea Kathleen Collins. Lisa M. Bassert. Bridget Ann Phillips. Rebecca Lee Mishiti. Lauren E. Ernst. Alexander Syed Long. Alicia Jeanette Lozano. Bridget K. Daly. Elizabeth Megan Lakata. Christina Elizabeth Fillmore. Whitney Elizabeth York. Michael Marion Thomas. Ana Ortegoza. Niha Ankit Lodaya. Megan Elizabeth Kirk. Matthew Dye. Ashley Claire Andrews. Patrick J. Benner. Kathleen Ann Rowe. Isan Sandra Maria Albertine Debo Amoni. Michelle Ann Gordon. Emily Kate Peterman. Andrea Cissy McCord. Allison Nicole Pinkover. Tara Suzanne Van Doren. Christina J. Bowles. Oluwatoyin Okonola Fadeyibi. Christine A. Simon. Ellen Ann Osola. Uduwak Udueyo. Mary Ann Miller. Mam Ketheyan Tata Mentan. Cynthia Evelyn Solis. Kasuma Schofield. Yusuf Kumali. Patricia Milnamo. Aisa Amina Oduro. Nadia Ann Nimley. Lauren Olivia Davis. Hamze Obiyunis. Regina Antoinette Clark. Ariel Abru Pena. Heidi Crystal El Nathan. Ashley Denise Moss. Ekena Yabechoku Achabe. Lacia Ekshayan. Cara Marie King. Victoria Clements. Nancy Hanson. Janet Elaine Fleetwood. Kimberlia Noel Gibbs. Lidivez Mejia. Gazi Vida Anostiki. Judith L. Ferguson. Congratulations to all of our master's degree recipients.
So congratulations again to all of our graduates. Drexel University enjoys a long-standing tradition of involvement and participation by its alumni in every aspect of university life. And I'm delighted to say that we have a wonderfully engaged group of alumni who have been working very closely with the school and with me to think about the directions that we're going in. And it's absolutely wonderful to have such a great involvement. I have to take a lot of notes when I meet with them and then do a lot of things, so they keep me on my toes. And we are delighted to have with us Madison Davis, 2015 graduate of the Masters of Public Health and Epidemiology, who is the current chair of Dornsive's Public Health Alumni Network, who will share a few words with us.
Good morning, everyone. It is my distinct pleasure to speak on behalf of the Dornsive Public Health Alumni Network today. First of all, congratulations to each and every one of you. It is hard to believe that a year has passed since I walked across this stage. I am sure that as disappointed as you all were to see me go, there was a small part of you that was relieved. Relieved because you thought you may be free from me asking you to attend events, get involved, and get to know your classmates, faculty, and staff. Well, I'm back. It is my distinct pleasure to welcome you into the Public Health Alumni Network, an alumni network that is now more than 1,000 strong. This network spans the country and the globe. Alumni work across the public and private sectors, and one alumnus even writes crossword puzzles for the Washington Post. What this means is that no matter where your path may take you, a fellow alumnus will never be far. The Public Health Alumni Network was revitalized over the past year, and I have the pleasure to serve as the current chair of the board of directors. The goals of the Alumni Network are to increase connections between alumni, support alumni career development, and increase your connection back to the school. We will be hosting regional events in cities such as Philadelphia, Washington, D.C., and Chicago, and this list will only continue to grow. We are organizing opportunities for lifelong learning to include regional and virtual journal clubs, seminars, and industry-led alumni panels. And finally, we will extend opportunities for you to provide your input back to the school from the perspective of an alumni. What I ask of you now is to keep your alumni profile updated so that we can contact you when events are coming to your area, to stay involved to help grow and strengthen the alumni network, to stay connected to your classmates, and most of all, to not unsubscribe from my emails. As you enter the workforce, your job may take you away from the immersion in public health you've grown accustomed to over the past 2 years. Remember your roots and what is important to you, and bring that to your daily life. Your experiences here have prepared you to enter the world as a public health professional. You have done the work, put in the time, balanced competing priorities, and still managed to have a bit of fun. Now it is your time to show the world what a Dornsife School of Public Health graduate is made of. Congratulations, class of 2016, you did it.
Thank you, Maddie. In this ceremony, we have paid tribute to the graduating class of 2016. And now it is the graduates' turn to salute those who have helped them along the way. And I would like the parents, spouses, partners, children, and loved ones of our graduates to please stand so that they may receive the thanks that they so richly deserve. And now I ask the members of the class of 2016 to salute their professors and mentors at Drexel University. Will the members of the faculty administration stand? Well, thank you so much for joining us today. We're excited to continue the graduation activities tomorrow, Saturday, with the university-wide commencement at Citizens Bank Park beginning at 10 a.m., where all the degrees will be formally conferred. We ask you to please stay in your seats when our ceremony ends until the graduates and the stage party have recessed. So congratulations once again to all. Take forth everything that we've hoped to transmit to you at the school and make a difference in public health. And congratulations and best of luck to all of you.